Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers.
That was so much fun. I just had a conversation with Dr. Theodore Burns. He's a professor. He is a licensed clinical psychologist. He's an educator and is really an author. And his message is so important to me. There are so many discussions that have become safe to have. We can talk about mental health in certain ways. We can talk about addiction. We can talk about emotions in a way. I think the emotional maturity of our culture, especially in young people, has really evolved. There's one discussion that's remains so hard to have, and it's this discussion of matters sexual. And Dr. Burns, his calling, in my opinion, amongst other things, but I think this is his passion, is how to use the term sex positivity and to talk about matters sexual in a non-beware, non-shaming way. Dr. Burns spent the whole time, we captured this idea of what would it look like to have a task force from A to Z, from all ages, talking about how to have the discussion, the hard discussion of what is pleasurable to me, what does intimacy look like for me, what are my boundaries, what is the messaging that I've received and how has it influenced me, and raising awareness in general it matters sex. So thank you, Dr. Burns. What an enjoyable conversation. Hi, nice to have you here. I have Dr. Theo Burns, licensed clinical psychologist, here with us. And, it's just an honor. This is actually take two. And I'm glad because take one was kind of weak, but I like this take two, and I'm so happy because the producer of this podcast really encouraged. I hadn't heard about Dr. Theo Burns, and the subject, which is always to me a little bit uneasy, right? It's not a natural flowing subject. Is about human sexuality, sex positivity. And something that I don't think is a very, very standard discussion in the way we're going to have it. So thank you for being here.
Thank you for having me.
And Dr. Burns is someone who is a researcher and a teacher and an expert, a real subject matter expert in the discussion of matters related to sexuality, sexual attitudes, and the outlook of our culture and the impact of the discussion of sex in general. Do I have that right?
Yep.
Okay. So in the spirit of how we do things here, and we were discussing it just before, the idea is about how can we help people, both clinicians and anybody listening, to develop a sense of, to educate people on how to get better and what it means to get better in this particular area, the area of sex. So why don't you tell us a little bit about yourself and how this discussion, how you inform this discussion in general?
Sure. So I am a licensed clinical psychologist in the state of California, and I'm also a licensed professional clinical counselor. I've been licensed here in California for quite some time. And I also am a professor of psychology as well as a sexuality educator. And what that means is that in a variety of different types of settings, so universities, high schools, middle schools, elementary schools, nursery schools, corporations, and larger community mental health practices, I go in and talk to individuals who are either themselves or providing care for individuals who may be struggling with themes related to sexuality. And that can mean anything from wanting to know more about oneself as a sexual being to understanding processes with one or more other people related to sex as well.
That's a big That's a very, very wide range.
Yes.
So from children,
Yes.
literally children,
Correct.
right, to adults in industry, to teachers, to it could be the age range is the whole lifespan.
Correct.
So there's a message, right, and it varies, right. So from a standpoint of the beginning of the discussion, right. So when we start this discussion of, let's pretend that I'm new in my career, right? I'm a clinical psychologist, and I want to begin the discussion of how do I broach this topic in general.
Sure.
So where do we start?
So where I usually like to start is defining one's own relationship to sex in general. And usually what that looks like is that clinicians of a variety of different disciplines do some self-examination about what their relationship is to sex. And what we know anecdotally as well as from research is that most individuals have an erotophobic relationship to sex. And I'll use that term. And what that really means is about having fear and kind of shame related to sexuality in general, and that we kind of evolve into humans as individuals that have that level of shame or fear.
So just out of curiosity, if I were having this discussion in the middle of France, in Paris, would we have the same sort of awkward, I'm thinking of our culture, not everybody, obviously, but I would say that, hey, let's talk about this, invite some awkwardness, right? Some, like, ooh,
Sure.
right? Does the discussion, is it particular in the United States of America versus other countries?
I like to talk about it in terms of a volume setting, so that it's present or it's absent, but we turn up the volume or down, or we turn the volume down related to the type of context or culture that we're in. And so within the United States, there are definitely specific kind of characteristics or kind of cultural values related to sex. When we move to Europe, we turn down the volume in certain areas. When we move to Africa, we turn up the volume in certain areas. So globally, you'll find different shades of that erotophobic culture.
So our erotophobic culture, to stick here, they're the characteristics that would describe it that are sort of across different segments of our population. What are you seeing?
So I actually really think it depends on a couple of different variables. One is that there is a real kind of interesting diametric related to sex, which is let's talk about it a lot and show lots of images, right? But as we show images, let's actually not use correct words, right? So what happens here is that sex permeates our culture in many different ways. However, as it permeates, we're given weird messages around, don't talk about this thing that is all around you all the time.
How do you see that? So let's just take an example of billboards or pornography or advertising. Is that what you're referring to?
Yeah, absolutely.
So then what's the part of what are we not talking about specifically?
Well, I think what we're not talking about is how sex can be pleasurable, how sex can be fun. And often what happens is we have these kinds of really interesting, so you use the example of advertising. We have these really interesting nuanced ways where we talk about, hey, if you buy this product, you can have these types of sexual experiences, but we won't actually tell you about the emotional intimacy with those experiences. We won't talk about what kinds of ways that those experiences can be pleasurable for you, right? We come from a pretty puritanical culture in which sex has been traditionally looked at for procreative purposes. And so only within the last several, I would say within the last century, actually, have we started to really dissect, hey, we can start to break apart sex, not to just look at it for procreative purposes, not to just look at it as, let's say, for the sole purpose of creating a labor force, right, to get really kind of economic about it.
Meaning like this is sex sells.
Not only that, but sex, I mean, if we look at the Industrial Revolution, sex was meant to create babies to be workers.
Oh, okay. So you're saying that the procreative messaging is like that. So I'm going down Sunset and I see tremendous billboards all over the South. And let's say I get charged. There's some messaging that's happening right? That says, wow, I want that experience.
Totally.
I want that experience. I have an idea about what that experience is. And I don't look at that as the charge develops, right? I'm not saying it's going to be a bad experience.
Right.
But what you're saying is it's more than good or bad, or there's obviously a pull towards that experience.
Sure.
But there's language missing.
And there's also, as I get pulled toward that experience, what kind of jockeys for that pull is I've also learned that this is bad. I've learned that I shouldn't talk about this. I want that experience, so I'm bad for wanting it, right? And if I want any type of sexual experience that is not in that billboard, then there's also something really like incrementally or exponentially wrong with me.
So I have charge. I'm a human, right? Humans have charge. Humans have pull, right? But what I say about myself as I'm moving towards that image, right, could be totally influenced and impacted by all of these ideas I have about what that means about me, which is it could be some version of I'm bad, I'm not good enough, right?
That's right. Yeah.
And if I and that it could actually open discussion of areas that I'm very, very shy about.
That's right. And instead, what we could be thinking is, wow, that billboard is delicious and awesome and super great. I can't wait to engage in that specific sexual act. I can't wait to connect with, my eros and feel kind of completely fulfilled from a sexual experience, right? That could be like sending me all the positive yumminess.
So let's say I look at the yummy billboard and then one of the messages is, wow, I'm never going to have that. That's designed for those people. I'm not good enough to have that experience.
Absolutely.
What about that messaging?
Well, that happens to many people all the time, right? Because I'm never going to look like that airbrushed billboard. And then I begin to wonder about myself as not only a human, but a sexual human.
So as an expert in the field, how do you speak to that part of the discussion?
I think one thing that is true is allowing individuals to connect with the idea that everybody has a sexuality and that the billboard portrays one kind, but that maybe there are other kinds that aren't portrayed in the billboard, right? Or maybe there are kinds that are unique to you, that there are as many different sexual expressions as there are stars in the sky.
So, but I see that as the elite experience. So you, the clinician, opens up the discussion of that is not the only brand.
Right. And it's also not even the elite experience. Like you think that's the gold star, but who said?
Who said is that's what they're selling.
Right. Totally. And so they can sell it, but who made them the expert in your desire?
And what do you usually discover in these discussions?
I think it totally depends on who you're having the discussion with, right? So what often comes up is first that people don't necessarily know who constructed that desire, and also what kinds of messaging people actually receive as they grow and develop about sex. So maybe individuals who came from certain religious cultures where sex may have been a topic that they couldn't talk about. Maybe individuals who work in certain types of industries where there are lots of messaging related to sex. Maybe individuals who come from certain cultural communities where sex is outlawed or taboo, right? And so part of it is not just about helping them deconstruct the messages that they receive, but that there's a direct connection also to what are the messages that I carry around with me.
Interesting. And what struck me in what you just said is when you start to explore, the answer could be, I have no idea.
Totally.
Like I'm a high school kid. Everybody's walking around with crop top shirts. I'm a female in high school. I feel just disgusted about myself that I want to sport that. Right. And I have a whole idea of what it means to me as a sexual partner, about, and then I wake up and where's that? And you're saying, where does that idea come from?
Right.
And maybe the answer is, I have no idea.
Right.
And I have no idea what that even means.
Correct.
And that's part one. And part two is how do we begin to deconstruct our own personal messages?
Mm-hmm.
So I want to shift gears a little bit. What does this, so we're both psychologists and I'm interested, this is painful, right? This is very painful if my messaging is I'm not good enough. and there's a standard, and I'm not it, and I don't want, and I can't talk about it, and there's no room to talk
Yeah.
about it. What is the impact on mental health?
So, one of the things as an educator that I do a lot with individuals where I'm learning with them is we talk a little bit about what are the messages that they've received in various types of sex education classes. And inevitably, one of the themes that comes up is either A, I didn't have messaging, B, I had messaging, it was really either toxic or bad for me, and C, there are ways that I carry that messaging around with me. Either I use it as their blinders. Maybe it's like some stress that's in the bottom of my back that I've literally had for decades, right? Or it comes up as me feeling disconnected, which can present as a variety of different mental health symptoms, right? So I can feel disconnected from my sexuality. I can feel disconnected from my physical body. And as a result, I could feel depressed. I could feel anxious. I could feel dissatisfied in my relationships. I could feel a lack of emotional intimacy. I may have had, as a result of certain sexual education experiences, maybe I had some messaging that made me feel like I couldn't give consent or have boundaries, and therefore maybe I've survived, let's say, things like abuse or trauma. And that presents a whole other series of symptoms. That those symptoms could include things like flashbacks, the need to use drugs or alcohol during sex in order to numb certain types of pain or experiences. As you're probably guessing, there's a lot of different mental health symptoms that can come up as a result of this.
So you go in, educator, psychologist, clinician, and invite participants to share about their own messaging. And lo and behold, and as you're speaking, I'm thinking to myself, this is such an important discussion, and it's not just one of many things. It's not just, well, it's important to discuss, finances. It's important to discuss, your relationship with substance. All of these are important, but I think this one gets shortchanged.
Yes.
It's such a basic, hey, elephant in the living room. This is something that is the human experience and has been forever and will be forever, right? It's something that's just alive and out there, but it gets shortchanged.
Yes.
It gets shortchanged. So you start to invite the discussion of what is your messaging, and because it's so important, right? I would imagine the burden of keeping of not addressing it or not having an authentic connection with your experience invites distraction and invites enduring pain.
Yeah. I will also say that I think during that pain, there's a lot of messaging normatively about how sex needs to happen during your development. So let's say I'm an individual who's received all this message around sex, that sex is bad, it's shameful, etc. But I'm also receiving these messages as I grow up of like, you need to get married and you need to have kids, right? Well, kids happen through sex, right? So then I have these kind of concurrent messages, and I'm trying to figure out how to do this while kind of subverting all of the shame piece, right? And then if I decide that I don't want to get married or I don't want to have children, then I'm literally taking this and scooping it on to all of the other negative messages as
So
well.
I'm bad. I'm supposed to have children, and I may not want to have that experience.
Right. That's right.
And I'm also a bundle of hormones, watching and being told maybe, hey, it's best you better restrain yourself. This causes a lot of pain that
Sure.
you're not ready for.
Absolutely.
Right.
Yeah.
So even, and I think it's important to say on many levels, this is just not the experience of psychiatric patients,
Mm-mm.
right? This is an experience that everybody, and I think it's safe to say, is everybody too inclusive?
So I think when we talk about sexuality, we talk about it on a range of experiences, right? And that at least when we look at sexuality, it's not always just, for example, physical attraction, right? That sexuality is encompassed by things like fantasies and emotional attraction and relationships or kind of intimacy, et cetera. And so given that there's those different ingredients of everybody's sexuality, we can look at sexuality and say everybody may have a relationship to it. For some individuals, they may not necessarily ever feel physically connected to somebody else, right? So folks who are on the asexual or ace spectrum may not necessarily have certain sexual experiences, but they may find incredible emotional intimacy, right? And that for them, that is their kind of eros. And so, yeah, I would say everybody, but I would qualify everyone of like, everybody looks very different across in that pool.
Right. So,
Yeah.
the responsible training is to have a sense of the various types of expressions in the arena of sex and intimacy that would be important for us to know about, right?
Yeah. So, when we talk about sexual training for therapists or psychologists, at the bare minimum, there's an introduction to kind of expressions. And what the research actually tells us, and my colleagues and I actually just did a study where we interviewed and surveyed a variety of different doctoral programs and asked them about their content related to sex. And one of the things that we found was that identities related to LGBTQ communities were disproportionately talked about, because part of the LGBT piece is not just about sexuality, but also about cultural competence. And so lots of programs are talking about sexual orientation and increasingly talking about gender identity, although in my opinion, not enough. However, the other pieces related to sexuality, related to sexual expression, related to ethics about sex, related to sexual or intersections between sex and other domains of functioning.
What do you mean by that?
So, for example, if I'm on psychiatric medication, how might that impact sex? If I'm taking certain types of, let's say, herbal supplements, what might happen with that? If I am let's say at a certain age where I begin to have sexual dysfunction, how might that impact my mental health? And how do I talk about that with a partner or partners, right? So all of those different pieces where sex might intersect with other types of modalities or domains that are more primary for us as therapists, how do we bring that in?
Oh, so you found that there's an absence,
Yes.
like a legit absence?
Like a significant absence, yeah.
Right. So again, important discussions. So if you had to shape, if your task, if the president of the United States of America, not this one, but any president of the United States of America, actually, even this one, said to you, "I'm starting a task force."
Oh my gosh, that would be my dream.
I know. I'm giving you. I want to set up your
My future?
I'm giving you your bucket list.
Thank gosh, I need a bucket list.
This is your top bucket list.
Yes, it
For
is.
some people, it's playing Coachella. For you,
For me, it's this.
it's this. So here's the task force.
This is my Coachella.
This is your Coachella. The task force is you are responsible for changing the culture around this discussion, and from A to Z, but starting with our youth and with parenting, right? And we want to see because what we're talking about right now has such a collective impact.
Sure.
So have you thought of this, and where would you begin?
So I think the words that I'm resonating with most in your charge are start, right? And one of the things that comes up for me often, I do lots of trainings in nursery schools with parents and with teachers, because one of the things that we see often with parents is young children who are, as early as the age of 2 will start to touch their own genitals, right? Because it feels good. And kids explore their bodies. That's part of what they do. And what happens in the culture that we live in is parents...
Don't touch.
Yes, right? And not only don't touch, but don't touch in exact that tone, right? Which is shameful. We don't say why we don't touch. We just say, don't do that.
That's for private.
That's right. Well, and sometimes we don't even say that, right? We just say, don't do that. Stop doing that, right? And then kids go to school and educators will say, you can't do that.
Don't touch.
And they'll call parents and be like, do you know what happened in school today? This happened, right? And then parents will start to freak out.
Right. They think they're going to be accused of some sort of problem.
Something, right. And so one of the ways that we start is we start talking about how we talk to young children about their bodies, right? We talk to them and we say things like, hey, you know what? I know that feels good. Let's talk about places to do that, right? Let's talk about who can touch your body, because many times children will touch their body and sometimes other people will touch their body. And because that still feels good for them, they won't know that it's okay for adults to touch them in certain places. And so when we talk to children about touch, it's not just about the touch that they do. It's also about the touch of, hey, who's allowed to touch you? Right? And then we begin to do preventative work related to sexual abuse.
So the starting point with children is, and what I really picked up about that, and I do a lot of work with chemical dependency, is it's how I approach the individual in a non-judgmental, non-shaming way
That's right.
is the essence,
Totally.
right? So and I can, even if I'm being funny and outrageous, if
Sure.
I'm saying, I can say so many things, but if the delivery comes from care and it comes from a non-shaming approach, I'm going
Sure.
to have a very different experience than if my anger comes out
That's right.
and my biases.
Well, and then the other thing that happens with adults is that we often don't use accurate words to describe parts of our body, specifically our genitals, right? And so what we do is we use cute names for words like penis and vulva, right? So we'll be like, don't touch your hoo-ha, right? And it's like, it's not a hoo-ha, it's a vulva, right? And when we actually don't use accurate words, we also send other messages to children.
What's your take on that? What's the implicit message when you say hoo-ha?
That this is a shameful thing that we can't talk about, so we have to give it another name. Right?
Right. It's almost like there's an infantilizing, but it's like supposed to be geared for a child, to
Sure.
palatable for a child. But you're saying that once you start doing that, it creates an atmosphere of this is something shameful.
Well, and what we do, what we actually find later, and I do lots of activities with individuals about language related to sex and their bodies. And one of the things that we find is many individuals of a variety of different cultural communities have all sorts of different words, right? But one of the things that we learn is that in the secrecy of all of these synonyms for our bodies, we find that there are emerging themes related to shame and also related to violence.
Right. Well, so let's say the opposite. If the parent says, "Hey, don't touch your dick,"
Right.
right? What's your take on that?
Well, I think one of the things that's important is to talk about when you're saying don't touch your dick, why are you saying that? And in what way are you saying it, right? Because if I'm watching TV and I look over and I see my 2, 3-year-old, 13-year-old, 15-year-old, like with their hand down their pants, right? That can sometimes happen. And there are ways to say to somebody, hey, you know what? There are places to do that versus don't do that. Right? Because that young person who may have lots of questions, right? And in my office, I hear all the time, I wanted so badly to ask my parent. And I knew that I couldn't talk to that person, or there was no one in my life that I felt safe with.
Absolutely. So the starting point is language delivery, appropriate language, and also prevention. Child gets, that's a message for parents,
Sure.
right? Child gets older, outside of toddler and latency, and they're starting to develop.
Sure.
Right? You're on the task force. Cool job. I'm hoping, I'm really rooting for you on this. What happens? What's the next chapter of the discussion?
Then we begin to look at how individuals start to learn about sex throughout their development in different ways. That's obviously developmentally appropriate, right? So we begin to look at ways that we talk about people's bodies. We also look at the ways that we begin to look at pleasure, right? Because so much sex education is geared around HIV prevention, right? And we live in a country where for decades, lots of money has been poured into abstinence-based only education. And abstinence-based only education really focuses on the idea of using a disease model to talk about sexuality. And there are only a certain percentage of states within the United States that are required to give sexuality education that's medically accurate, right? And so what comes out when we look at abstinence-based education are the outcomes. The outcomes of, do people feel prepared? No. Do people actually, unfortunately, are they more likely to not talk about how do you give consent? How do you ask for consent? How do you use a condom? Right? So in these discussions about abstinence-based education, we're actually not imparting young people with critical thinking skills about how to engage in lots of different scenarios where sex positivity or sexuality can be engaged.
So it's a beware mentality.
Totally.
So I want to picture the all-star parent in your eyes of a 12-year-old girl or a 12-year-old boy, right? What do you see as the like, what's the all-star parent sound like? Could you model for us, what, anybody who's a parent, you have, you know, kids who are coming into adolescence potentially. What does it sound like to be like, wow, I'm so impressed with that parent?
I think the first thing that comes the first thing that comes up in that would be something like individuals who are able to have conversations specifically related to what pleasure might look like and how pleasure might come from a variety of different sexual experiences.
So moving away from the beware model and into the discussion of, hey, this is so pleasurable. It's such a great thing.
Yeah, and again, when we move away from the beware model, that doesn't necessarily mean that we don't talk about protection, safety, consensual sex, right? Communicative, right? So we're not necessarily voiding the conversation of things like STIs. What we are doing is having a conversation that doesn't solely focus on that, because so many people will tell me as adults, my sex ed experience was solely focused on if you have sex, you'll get these diseases, right? And it's a disease model.
So how, in this discussion, how do you approach the young adolescent who's also having a lot of feelings of
Sure.
love? Is that part of your discussion?
Absolutely.
So how do you deliver that?
That sex is a multifaceted, complicated process, and that you can have amazing feelings that come from that, and that as you start to explore and discover different parts of your sexuality, there will be feelings of pleasure. There will be lots of emotions. There will be things that connect you, right? And I often talk about sexuality as being layered, right? And that it's layered not only in terms of what we feel, but also in terms of like what we think, how we're touched, right? So that it's also layered sensorially. And so being able to kind of speak to all the different ways that can be there, but that also to really explicitly note that with some of those positive aspects, there also comes a lot of critical thinking that needs to happen. That when we feel things, we have to be able to start to think about them, right? And so we also have to think about our bodies, our safety, our well-being, right?
So since this is a task force discussion, and since we are not tied specifically to an agenda of a party, right? We are true bipartisan in this discussion. How do you speak to someone who does come from a religious-based home, who does believe that it's better to separate, children, of sexes to
Sure.
separate, and that they really do believe this is best saved, and that the best saved for the sanctity, and this is the
Sure.
words. How do you speak to them, and how are you culturally sensitive to that demographic?
I think one of the things that's important is to look at, again, we talked earlier about the intersections, right, between sexuality and other parts of people's lives. And so then being able to really talk about when, as we're learning about sex and these positive pieces or these pleasurable aspects, that they're going to interface with all these other parts of who you are. There are going to be cultural messages, right? There's going to be messages that you receive from family and community and school. And so let's look at ways that you bring all of those together and you begin to say, yeah, okay, so you have, let's say, a religious tradition that really speaks to very specific ideologies related to sex. That doesn't mean that if by chance you have an experience that it might not be pleasurable, how will you rectify that? Right? So then it doesn't become do this, don't do this. Right? But how do we increase relativistic thinking?
And it's all discussion. And I think it's important to me. One of the indictments of our field, I think, is that we're left leaning and that agendas could come out.
Sure.
Right? Agendas can come out in our discussion. There's
Sure.
a lot of feelings about this. But in this task force, I like the idea of it's language based because it's all about the delivery of the message.
Sure.
So moving along the continuum of this, raging hormones of middle and late adolescence, high school, college, the discussion.
Sure. Then I think what we begin to also look at is as individuals start to develop, what do things look like related to pressures for intimacy, marriage, family, their own child rearing, right? And as individuals start to see changes in their own body as they move from young adulthood into middle age, right? There are huge messages that sex is equated with youth. And so then as people get into certain age brackets, they begin to think about themselves as literally like sexually deceased. And so how do we then begin to create a sexuality that is lifelong? Right.
So this is an exclusive. You're not out of the game if you feel like you're not invited to the party of middle and
Right.
late adolescence. For some reason, you missed that train, right? It doesn't mean that you're done.
And that actually you've been invited the whole time. You may just not know how to read the invitation.
Right. And that's a different discussion.
That's right.
Right? Because the messaging is there. Those people who look that way get to do that.
That's right.
I look this way, I don't, or I
That's
feel this
right.
way, I don't. A good therapist, part of the task force is welcoming discussion
Sure.
of why you don't
That's
feel
right.
like why you even feel that there's a party that you're not invited to.
Or maybe, to complicate that, it might be that I look a certain way, but it could also be my body changes, right? Certain parts of my body used to work in certain ways and it doesn't work that way anymore, right? Maybe I don't have as much lubrication. Maybe I don't get as erect, right? Or maybe there are certain types of kind of hormone differences, or even as I grow into kind of older adulthood, maybe I'm not as limber. Maybe there's certain types of ways I can't move my body.
As for the older. So for going back to the adolescent, right? The adolescent gets naked for the first time. I am so embarrassed. I can't believe someone has eyes on me. It feels awful to be seen.
Right. Because then one of the things that we look at is it's not just about sexuality, but it's about shaming of one's body, right?
Part of the discussion. Has to be.
Absolutely.
Intersection.
Sure,
Yeah.
right? Because then what you're looking at is not just who are you as a sexual being, but who are you as a human, right? And let's connect to your own body. And what messages have you received about body, right? And as we know, outside of just sexuality, but closely linked, people from very young ages receive messages about what they're supposed to look like.
Yes. And
Yeah.
which also is a big shaper of this experience that we're
Absolutely.
discussing.
Right?
So many intersections.
Sure.
So many intersections. So I finished college. I'm or not. I decide to have a mate, right? What type of discussion do you have to couples?
So what's interesting is so for individuals who want one partner, right? What we talk about then is what does intimacy and how do you construct intimacy? Because what often comes up with related to sexuality is now you're in a relationship with somebody else, and not only are you working through your own messages, but you're also a witness to their messages. And that all of your messages together, you cohabitate with somebody, you also cohabitate with all of their sexual messages.
Right.
So then you're also working through how do we learn how to communicate about these? But also, as I grow as a young adult, I begin to think, gosh, you know what? I'm doing all of these different processes with my partner or partners where I'm having to think really critically about the way in which it's not just about my pleasure, but also about increasing intimacy so that these other people that I'm in a relationship with can also feel pleasure. And how do we do that? And that sometimes we're all not going to feel pleasure together. Like it's not going to be like the movie where the waves crash and the sun comes up and everyone has orgasmed perfectly, right?
So this is probably thousands and thousands and thousands of books have been written about this, but I'm going to ask you on the spot, how do you bolster intimacy?
That's a loaded question.
Sure.
Let me think about that for a second because I'm trying to dilute those thousands of books into a really great answer. One of the things that comes to mind, obviously, is there's a key series of ingredients, right? One of them, obviously, is self-awareness. Another is communication. And then the other is the ability with those individuals to look at what intimacy looks like for you. That intimacy for everybody looks different. Right?
So I'm in our task force. We're dealing with couples of all varieties, single partner and multiple partners. But there's still a discussion at the core: is what does this mean to you?
Right.
So I'm teaching. I'm playing. Like I'm creating mini therapists,
Mm-hmm.
right? If I'm a good clinician, I'm creating an atmosphere of discussion where one partner says to another partner or partners, what does intimacy mean to you?
Right. That's right.
What does that word mean to you?
Sure.
What do you want it? How can I contribute to your experience?
And some people may not use the word intimacy, right? So that because we live in a culture where sex may only be about procreation, it may only be about biological processes. Some people, you might ask, what does intimacy mean to you? And they're like, you mean orgasm? right? Because they don't think intimacy. They think sex is a biological process with an outcome, right? And so then it's also about expanding a conversation to look at maybe the way that individuals begin to increase their sexual pleasure is not just through increasing the frequency of orgasm, but also increasing all of these other pieces related to the sexual process.
And I want to say to anyone listening is that this is very hard. This is, we're both sitting here spouting in a certain way. Oh, this is what you do. And I know in the interest of time and so forth, but the ability to show up honestly to this conversation, especially if there's elements of shame, especially if there's fear. What if I say something that I like that is going to be like, you like that?
Absolutely.
Right? That's some vulnerable risk taking.
Well, and I think it's also hard sometimes to say to somebody, was that good for you because it wasn't good for me? Or I'm scared that wasn't good for you. Right? Yeah.
Right. How do you give feedback?
Right.
So in the competency that you would be referring to for somebody to get help, this is all part of the discussion of therapy.
And what is so key is that because individuals come in and don't know how, that a therapist then has to know how to not only ask the questions, but be prepared that individuals may have never, they don't even know the questions existed.
This is a totally different language.
Right.
It's an operating system that's totally unfamiliar.
Right.
Right.
Totally.
And the assumption with a lot of other areas is that there's more information that are, in other words, the average person may actually know more about anxiety conditions than they do about sexual discussion.
Absolutely. And I want to pair this part of our conversation with another pair that we talked about earlier, which is individuals aren't having these conversations in their training. And so there, as we're talking, we're seeing, almost kind of magnified all of the things that we need in order to have healthy conversations about sex with clients. But with all of this comes a specific need for training, and there isn't that training. And so not only are we not talking about it because we're not trained, but then inadvertently, we're also reinforcing messages to clients that because I don't ask, this isn't something we should talk about.
Task Force Part B.
Part B.
Part B is infrastructure of training.
Right.
In medical school, not just for therapists, but also for any provider of service.
Right. Because we talk about it because you and I are both in the mental health field, but I would wonder out loud with you how many medical providers, right, ask about their patients, not just sexual health, but like sexual pleasure, right? How many individuals feel unashamed to talk about certain pieces of sexuality. And especially if you're working, as we talked about earlier, with, let's say, adults in midlife or in older age, right? If someone says, gosh, you know what, I need some help to, let's say, make my left leg limber because there's a certain sexual position that my partner really likes, right? Would a medical provider be able to have that conversation or say, oh, well, I don't talk about that.
Right.
You should ask the nurse about that.
That's fascinating. So moving along, that's the discussion of the task force is about as someone gets older, right? They're not there. It's not the death of their sexual beinghood, right? So that one of your messages, one of your educational pieces is how do you maintain sex even in old age?
And what's interesting about older adulthood is that increasingly the literature finds that some of the highest incidence of new STI and STD infections are in older adults. And what we know is that generationally, this is a generation of individuals who have not had comprehensive sex education, who have not necessarily been taught about how to use a condom.
So there's a preventative element to that population.
Absolutely. And then these individuals, let's say, may have experienced the death of a partner or partners, are newly single, don't necessarily know how to talk about condom usage, and are then placed in, let's say, assisted living facilities, which are basically glorified dorm rooms, right?
So they get to have tons of sex.
Let's hope, right?
Yeah.
Yeah. And let's hope, but are they being told about how to do so with communication and safety?
Interesting.
Right.
So have you been in a position to educate about this?
Absolutely. Because what's true is increasingly older adult care facilities are reaching out and saying, we have these higher incidents and we need someone who's trained to come in and have conversations with individuals about literally like, here's a banana, here's a condom, put this on.
And that's you.
Yeah,
Unbelievable. So I have two more lines of questioning I want to go.
sure.
You mentioned training in industry in
Uh-huh.
corporations.
Totally.
I was just that's fascinating to me. Outside of this discussion of sexual harassment, what training is there?
Not much.
Okay, so Dr. Burns is brought in for that discussion of language in a workforce.
Sometimes, yes. Sometimes it's about language in a workforce related to consent and about healthy sexual boundaries, right? Sometimes it can also be about understanding how those types of like workplace interactions may be informed by like our previous or lack of messaging related to that,
So you're a
right?
real educator about language and about just competency,
Yep,
a basic competency of how to
sure.
interact in a non-threatening way,
That's right.
in a boundaried way.
The other area I think specifically is being brought in to speak about very kind of openly with mental health workforces within corporations or even kind of like large county facilities around how do we talk about this? So, working, let's say, on a contract where maybe you go to a series of workshops that are, anywhere from 3 to 6 hours, but they range across, let's say, a 9-month time span. And we go through these different domains of knowledge and skills to make individuals more able to have these conversations.
Interesting. So I'm going to put you in one more place. I put you in the Midwest, and you go to one of these big, whatever they're called, some football league. I forgot the name, Big 12.
Sure.
And
Yeah.
your task is to go to each college and to each fraternity and sorority and
Sure.
have discussion. What do you talk about?
Well, so I think what's true is you can go into a lot of different arenas and a lot of these types of messages are very similar. So you can put me in a sorority in the Midwest. You could put me in an academic social group in a university in Manhattan, right? And what will happen is that all of these young folks have access to this thing called the internet, regardless of where you live,
Uh-huh.
right? And so although what they view may be shaped by their cultural value, a lot of the messaging and the shame is very similar. Right. So what comes up inevitably is having conversations, regardless of where we are, using the same values related to pleasure, related to critical thinking, related to understanding that sexuality is individualized, that you get to intersect your sexuality with all of the different messages that you receive or the different types of culture and community that you're in, but also knowing your context, what are maybe nuanced ways that you may need to shift ideas related to communication, related to safety, related to consent,
Yes.
right? And that I think those pieces would obviously be slightly shiftable depending on the culture and context that you're in. But I mean, I have definitely gone into large universities and had conversations with students. And I feel really comfortable having conversations called, hey, you know what's true is everybody deserves to feel good. However, your feel good is not somebody else's feel good. So why are you trying to take that from them?
Interesting. I want to as we close, I'm in a world of specialty. A lot of specialists in our field. There's trauma specialists, there's anxiety specialists, there's mood specialists, there's techniques, and so forth. So I'm just curious, speaking to the clinicians of the world, what if somebody who comes in pained without target diagnoses that are pronounced, right? What is the impact of this discussion clinically in your experience? In other words, let's say I was studying a case of yours, and yes, there's a host of issues. How much help does this discussion have, in your opinion, with your patients? Just the deconstructing and all these things. Let's say that we studied it as a technique.
Sure.
What's your take on it?
So I can speak empirically, but I actually would rather speak kind of anecdotally.
However you want.
And what I will tell you is that there is an inevitable strengthening of my relationship when I bring this in. And even if I start a discussion or start a clinical relationship and say, if you want to ever talk to me about these sexual pieces, I want you to know that we can do that here. And what inevitably will happen at some point is that client or clients will kind of look down at their hands and they may twiddle their thumbs and they may be like, remember that time that you said that we could talk about
Could be months later.
years,
Right.
that we talk about that sex piece. And I'm like, of course, yeah. Is there something that you want to bring in today? Right. And that as they begin to share pieces of themselves, helping them remember that this is something that is valued as part of our relationship, that I'm not here to ever judge what they might be doing. My goal is to make sure that they feel safe, right? And that I'm really here to help them explore how these pieces of themselves may or may not be related to what they initially came in for.
So how impactful is that from your seat?
I will say, and again, I'm a little biased because obviously I specialize in this area. I think it's quite impactful because I may be the first, if not the only person that will ever allow individuals to explore that. And in a world where they've received all of that messaging, to have somebody say, let's put that aside and you just tell me about you.
It's so much more likely that I'll share about my OCD shtick than I will about this stuff, in my opinion.
Sure.
Right? That this is an untouchable. So my instinct in listening to this is, if part of your informed consent process, that's the discussion, the initial discussion we have is, and by the way, if you ever want to, this is an area where you can feel safe and a non-threatening, non-judgy environment. It's up to you.
And let's take this out of the therapy context for a second. What can also happen, so as an educator, if I have conversations with students where I say, what would it be like to bring this more into conversation? Inevitably, what happens for students is they say, I started talking about this with people in my life, right? Like I talked about it with my partner, or, someone said something really erotophobic at work. And I said, hey, that's not true for everybody. Or people see me, having a more sex positive stance. And then privately, they come up to me and they say, hey, can I ask you a question? Right? So that when we're open and we bring in that openness, it's mirrored back.
Interesting. So in your seat as educator, as researcher, do you think that, and maybe there isn't research, as a standalone, do you think that, it's hard to say as a standalone, but do you think this is a contributor to symptom reduction?
Yes.
So if someone has an anxiety, a generalized anxiety, that means they're a worrier. If somebody is like a chronic worrier or somebody is a depressive, does the invitation and participation in this discussion actually reduce symptoms?
So it's hard for me to blanketly say, do this and this will happen. Right. But I will say anecdotally, I have seen that. Now, for every norm, there are exceptions. And I want to be super clear that like bringing sex into every conversation is not going to reduce every client's symptoms that you have. But I will say that in general, absolutely, I think it can't hurt.
So I'm not speaking as a researcher, and I'm not throwing out the term evidence-based. But in my experience, there's something about real connection and real talk and authentic discussion. And when I bring different people in who are experts, you can see it as somebody has mastery. The more authentic I can have a conversation with somebody, the more connected,
Sure.
the more likely there will be symptom reduction.
Sure.
That with all the techniques, which are great, absent that, and this is a real big ticket item, this discussion we've been having.
Sure.
So if I invite that type of authenticity, my instinct is that invites symptom reduction too.
Yeah. I think that's right on, actually. And what are the things that we also do know is that regardless of whether we couch or contextualize this as an evidence-based conversation, we know that inviting individuals to be authentic, right, and to know themselves kind of explicitly within our room can lead lots of different places.
Yes. So this has been very, very helpful for me personally. I love the discussion. And just if you had to make a recommendation in terms of literature for the public, not necessarily for clinicians, books people can refer to for more, or some sort of information that people can gather if they wanted more information, where would you send somebody? Or what would you recommend?
I have so many books, sorry. But I think in terms of the intimacy conversation that
Sex positivity, the discussion that we had, the starting point, the task force agenda.
Sure. So one of the books that I love right now that's great is called Sex Plus. It's by Lacey Green. And Green writes kind of over in a variety of different ways about kind of different facets of that process, which I think is great. And I really appreciate just her ability to look at different facets of that as well. I think for clinicians specifically, there's a great series of articles related to in the Counseling Psychologist in 2017 that looks very specifically at not only what sex positivity looks like, but also looks very specifically at who they are within their role as clinicians overall. And then the other book that I recommend a lot of individuals, especially related to kind of sex positivity and intimacy, are books related to kind of polyamory, et cetera, which The Ethical Slut is a great book. And I recommend that a lot for couples who are just exploring themselves. More Than Two is another great book. Opening Up by Tormino is another book that I would recommend.
Wow.
Yeah.
You do have
So
a lot of
many.
books to recommend.
Yeah.
So,
Oh my gosh, I
so
love to
for
read.
for those who are listening and want and really want to start to have this discussion, if they wanted to reach you and contact you, what's the best way to reach you?
So folks can find me via the Psychology Today website, Theodore Burns. I also have written a couple of different books. So if you are on Amazon, you can check me out on Amazon as well. The books that I focus on really have to do more with teaching and training related to areas related to culture and then sexuality specifically. So feel free to check those out as well.
Amazing. This has been so rewarding. I so appreciate you coming.
Yeah.
A great discussion. And I have a feeling there's part 2, part 3, part 4, and part 5 of these types of discussions.
Yeah, I agree. And I'll be enlisting your help with our task force.
Excellent. Thank you so much.
Sure.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.